Welcome to those who have just joined. We are just giving people 1 minute or so to join us today. And then once that has happened, we will kick off probably in about 30 seconds from now. We had a large number of registrations for this conference, for this presentation. So it's wonderful to see. So it often creates a bit of a flood as people dial in. We'll just give people a chance to do that before we start. Okay. So I will formally kick us off and welcome everybody to this forum. Uh, my name is Carolyn Gillespie. I use she, her pronouns, and I am the CEO of Women's Health in the North. It is my great honour and privilege to be facilitating the panel and the presentation and webinar today. So thank you very much for joining us for this webinar, Allyship in Action, Frameworks for Trans and Gender Diverse Inclusion in Prevention of Gender-Based Violence Initiatives. Women's Health in the North is so pleased to be partnering with Belle's Gender Collective to bring this really critical work to the sector. I just want to say up front that I have been explicitly invited by Belle Gender Collective to MC today's proceedings and to represent both of our organisations. And this webinar and resource are about allyship. Belle Gender Collective are openly inviting us to stand up as allies and to take responsibility. Inclusion is everyone's responsibility. Addressing transphobia and transmisogyny is everyone's responsibility. And cisgender people like myself and like many of you here need to step up and take action. And this call to responsibility, very pleasingly, as we see in the webinar today, is being met with real momentum, which is reflected in the number of presentation registrations that we had, which at counting as we headed into this presentation was over 350. And I think that reflects to us the global contexts in which we find ourselves and how much there is wish to see change. So importantly, as we start, I would like to acknowledge the Victorian Aboriginal people as the traditional custodians of the land on which we work and which we live. We pay our respects to elders past and present and acknowledge that sovereignty was never ceded. Win and all of us here recognise the ongoing leadership of First Nations people and communities in promoting gender equality and the prevention of gender-based violence. We are committed to self-determination and to support treaty and truth-telling processes. It always was and always will be Aboriginal land. So before we move further into today's context, I want to take a moment to really recognise and pause about what is happening in our current political environment that we are all navigating. There are many communities, including trans and gender diverse people, First Nations communities, people seeking asylum, people of colour, disabled folks, and others who are experiencing appalling discrimination and who are feeling the impacts of intensified public debate, political uncertainty, and deeply harmful rhetoric. And I know this distresses many of us. So talking about trans and gender diverse inclusion today does not occur in a vacuum. We recognise that for many people, the current climate is not only politically challenging, but personally and emotionally exhausting. And as we focus today on frameworks for inclusion, I want to be clear that our commitment to equity does not and cannot exist in silos. We stand steadfast with our trans and gender diverse colleagues, friends and communities, and we stand in solidarity with all communities impacted by discrimination, marginalisation and human injustice. Our work in preventing gender-based violence is rooted in an understanding that systems of oppression are interconnected and that meaningful prevention requires us to challenge these systems collectively. Today, together, we have an opportunity to reinforce that commitment, to centre care, hope, evidence and community leadership, and to build the future that we wish to see, and that is a future free from violence. So before we move on, please take a moment to check in with yourself. Today's context can bring up difficult emotions. It is hard to sit with some of the injustice that we're seeing. If at any point you need to step away or to reach out for the support that you need in the way that you need to seek it, please do so. We really encourage you to do that. We will provide you with support details again at the end of the session. So firstly, for those who may not know much about women's health in the North, I thought I'd just give you a brief overview about our organisation and how we've come to be here in this place. So Women's Health in the North is a regional women's health promotion, violence prevention and advocacy organisation in Melbourne's Northern Metropolitan region. So we cover 7 LGAs or local government areas across the region. And our focus includes the prevention of gender-based violence, family violence, system leadership, sexual and reproductive health, gender equality, and mental health and wellbeing. And we're part of a well-integrated statewide network of 12 women's health services working together for the health, safety and wellbeing of women and gender diverse people right across the state of Victoria. Our partner in this work, and with whom we could not do what we're doing, is the Belle Gender Collective. I'll call them ZBGC. ZBGC is a trans and gender diverse led organisation based here in Victoria, Australia. And I recognise that there are folks joining us from right across Australia. And there are, of course, trans organisations working nationally in every state and territory in Australia to support this work. So Belle Gender Collective has 2 areas of strategic focus in their work. Firstly, the primary prevention of gendered violence that is experienced by trans and gender diverse people, and improving the lives and wellbeing of trans and gender diverse young folk and their families. So many of you may be wondering where this work has come from. And Wyn and Belle Gender Collective have been working together for a number of years now on trans inclusion within the prevention of gender-based violence space. And over the last couple of years, Belle Gender Collective has been engaged with others right across the sector for training and other workforce capability building initiatives. Through this work, Belle have identified issues with the sector and approached Wyn to work together to address these issues. By and large, what we find and what Belle have found is that the sector is generally on board with these conversations and being part of these dialoguing. But even though that is true, there is definitely further capability work needed. And the people who really believe in this work want to bring together trans justice and gender equity movements. And this today is an opportunity to do exactly that. But the issue is that many of us don't actually know what to do or where to start. And I wonder about how you can actually turn these principled values commitments into practice change in reality. So this has brought us to the development of this resource and the strengthening of the partnership between Belle Gender Collective and Wyn. So we would also like to thank trans and gender diverse people and allies from other organisations who also contributed insights and contributions to the resource. And those people and organisations are Safe and Equal, Rainbow Health Australia, Switchboard Victoria, Free, Women with Disabilities Victoria and Respect Victoria. So just some quick housekeeping before we move on to the webinar proper. We have some housekeeping notes that really want to support creating and maintaining a respectful and safe space. This session is being recorded so that you can share afterwards, or others who are not here today have the opportunity to dial in and reflect later. It is a Zoom webinar, so you are not visible at all in the session, only the presenters and the notes are visible. And you can turn on closed captions setting if you need them at the bottom of your screen. I want to be clear that there is zero tolerance for discrimination, harassment or vilification in this learning space. Moderators may and will intervene and remove participants if there are behaviour breaches that breach these guidelines. So thank you for joining me collectively to maintain a shared and safe space for everyone today and for maintaining these standards and our shared values. I invite you to submit questions via the Q&A function, as the chat function is disabled for today's session, but we do welcome those questions, and where we have time, we will put those questions to our panellists. There are three main sections for today's webinar. Firstly, I'm delighted to have our Victorian Commissioner for LGBTIQA+ communities, Jo Belle, here to provide some opening remarks. That will then follow with a keynote presentation from Star Lady, who is the director of Zoe Belle Gender Collective. And that will be followed by a reflective panel discussion with the co-authors, Star Lady and Tilly Marnie, as well as who's from WIN, as well as our allies and contributors, Ange van der Berg, who is from Grampians Women's Health, and Monique H from Switchboard. So without further ado, it is my great pleasure to introduce my colleague and friend, Jo Belle. Jo, he, him, is a proud commissioner for LGBTIQA+ communities and is a proud transgender man. The Commissioner advocates for the rights, safety and well-being of everyone within the LGBTIQA+ communities. He is a long-standing advocate with a 25-year career in disability, housing and homelessness and social services. Commissioner Belle was the former CEO of Switchboard Victoria, where he oversaw the establishment of Rainbow Door, which is the statewide family violence and mental health helpline for LGBTIQ folk in Victoria. Jo is a member of the Expert Advisory Group for the Federal Government's 10-year LGBTIQA+ Health and Wellbeing National Action Plan, the Victorian Family Violence Reform Advisory Group, and has participated in leading advisory groups with Safe and Equal, 1-800-RESPECT, and the National Suicide Prevention Governance Committee. Through his career, Jo has drawn on the strength and guidance of queer history and the work and wisdom of courageous LGBTIQA+ activists who have paved the way for many of us. And my great welcome to you, Jo, and thank you for joining us.
Yeah, thanks, Carolyn, and thanks in advance to my fellow speakers and to the incredible work that Zoe Belle and Women's Health in the North have done around this resource. I'd like to start by echoing an acknowledgement and pay my respects to elders past and present. I'm on the lands of the Wurundjeri people of the Kulin Nation. I remain committed to what is the largest consensus of First Nations people in this country, and what they've asked of us is to support voice, treaty and truth. The referendum is not the end, and that was never intended to be. And First Nations people still ask us to support voice, treaty and truth. In Victoria, we have the first treaty. However, I always caution with this by saying that treaty is only something we need to all work through and work on and commit ourselves to. It has been written into law, both types of law, LAW law and LORE law, by governments and First Nations people, but it does belong to all of us to make it real. So it's wonderful to be here, and some of the things I'm going to bring up today, I don't have as much time to go into them, but I hope that they might inspire you to look into them more, some of the historical stories. And I will share an article that was published yesterday that I wrote, which does talk about some of these things, and other articles if people do want to read more about some of this. So on the 16th of March 1974, which is almost 52 years ago, a group of feminist women broke into two adjoining vacant houses owned by the Church of England in Glebe, Sydney. Those houses would become known in time as Elsie's Refuge. This was Australia's first refuge for women and children fleeing family violence. This was, of course, the beginning of our movement and what we now call the family violence sector. Undoubtedly, I think they were very difficult women, if you will. Hopefully people get that reference and my sarcasm about it. It's hard without a live audience. But Elsie was born from a very simple but radical idea that all women deserved safety. Almost a decade later, in 1983, a lesser-known historical detail, transgender woman sociologist, sex worker and sex worker activist Roberta Perkins was documenting the lives of trans women experiencing violence and homelessness. Many were sleeping rough, as Roberta found, many were surviving abuse, and many were being refused access to the service system because they did not neatly fit into existing gendered services categories. However, Roberta, inspired by the women's liberation movement and the model of Elsie, Perkins helped establish Teresha's House, which was ensuring that trans women too had a refuge to go to. Today, we know that house as the New South Wales Gender Centre. What is really interesting about this historical fact is that through client records and call logs that have been documented by historian Rosa Campbell, who wrote an article that just came out only months ago, is that through the call logs and the client records of both refuges, the violence experienced by trans women mirrored the violence experienced by other women. Now, that probably won't come as a surprise to many of us, but I think it is really important to understand this history. As Perkins herself wrote, now I'm going to use the word, Perkins uses the word transsexual. A lot of transgender people don't, but that is the word that she's using in the 1970s. She also references by calling trans women girls, a term she uses, but when I say girls, she's talking about trans women. So as Perkins wrote herself in the 1970s, men expect the girls, trans women, to act as the beautiful, receptive, passive woman, and she is treated as a powerless, feminine, inferior creature. What applies to women in general also applies to the transsexual. Because she dresses a woman, she is asking for it. Now, she's saying this in the 1970s. It's important to recognize this. So, historian Rosa Campbell's research helps us understand what actually happened next. Alongside this shared experience of violence was actually a shared history of activism. Now, we're told currently, and there's a court case containing otherwise, that the inclusion of transgender women is something that we are fighting for now, not something that has actually existed in the feminist movement from as early as the 1970s. So feminists and trans women were not opposing movements. Of course, there was difference in agreements, and there was people that were trans exclusionary then as there are now. But the idea that there was a monolith of trans exclusion is not true. In fact, trans women who worked at both Elsie and what will become the New South Wales Gender Centre, they collaborated in practical, everyday ways between the refuges. Feminists supported trans women organising, and historically, in a very important moment, feminists supported trans women organising for safer working conditions, including in Sydney clubs in the 1970s. The women's liberation activists proudly and famously stood alongside trans strippers striking for dignity. Again, the language of the day, for safety and pay. At this famous strike for pay that was supported by the women's liberation movement, there was also members of the women's electoral lobby, which might be surprising to some. Refuges shared information and referrals. So between the two refuges, feminist workers contacted Teresa's house regularly, seeking support for clients that they had in their refuges. Trans women leaving prison were referred into feminist housing services, and staff and organising networks overlapped. The historical record shows us cooperation, not conflict. And in fact, feminism did not collapse, the refuge movement did not unravel, and safety was not diminished. In fact, safety was expanded. Women looked at who was still excluded from protection and chose to widen the circle. They recognised the shared reality that gendered violence harmed those pushed outside of social protection. The lesson from that history is clear. Safety has never been built by narrowing who belongs. It has been built always by expanding care. So my name is Jo Ball. I'm the Victorian Commissioner for LGBTIQA+ communities. Carolyn said that I'm proudly a transgender man. And I always put that in my bio, one, because it's true, and secondly, because visibility matters, and that and it's important for the recognition that trans people live in every town, every suburb and city, every workplace, and in every profession. And we deserve to see ourselves reflected everywhere, including in leadership roles within government. That's why I always put it in my speeches and encourage people to introduce me that way. So thank you to the Women's Health in the North and Zoe Belle Gender Collective for your leadership in working towards communities free from violence, and all my fellow panelists. Just quickly to go back, my role as Commissioner is to advance the health and well-being of all LGBTIQA+ Victorians. Before this role, I spent 25 years working across the disability services, housing and homelessness, and the family violence sector. I've been a board member of Safe and Equal. I've been a committee member of 1-800 Respect. Across all of those settings, one truth has remained constant. Violence does not occur in isolation. Sexism, misogyny, homophobia, biphobia, transphobia, intersexism are deeply interconnected. Sexism punishes those who challenge gender expectations. Homophobia and transphobia grow from the same roots. When we address these forces together, prevention is at its strongest. However, when we divide them up, violence finds space to grow. And we are seeing that risk now. In recent weeks, Australia has witnessed deeply disturbing violence targeting gay and bisexual boys and young men. Many of us remember when violence against gay and bisexual men was just normalised. And for many, it was part of their coming out story. We cannot return to that, even though we are seeing this violence against these men within the hundreds. Preventing violence requires all of us: parents, schools, sporting clubs, community leaders, media organisations, and online platforms, and of course, government. Primary prevention, though, is only as strong as its widest reach, because exclusion does not make communities safer. And this is what I want you to hold on to today in my message and in the story I told about Elsie and the New South Wales Gender Centre, is that exclusion does not make communities safer. It is solidarity that does. And history tells us this. Moments of social progress are often followed by moments of uncertainty, moments when societies begin asking who belongs. We are living through one of those moments right now. In the past fortnight, alongside rising concern about violence against LGBTIQA+ people, we've also seen a federal court challenge which has sought to narrow the interpretations of women-only spaces under the Sex Discrimination Act and challenge the Sex Discrimination Act, as they have done successfully in the UK. Of course, in a democracy, people can test laws, and that can be part of the process. But I think we must hold on to the idea that history tells us there is an immense caution around these challenges. When communities facing external violence turn inwards on themselves, focusing on exclusion rather than confronting the communal harm, the collective harm itself, safety is rarely strengthened. There is very little evidence under the UK change to their Sex Discrimination Act that lesbians, queer women, and women in general are seeing more services or greater safety. In fact, the opposite is true. Because the real threat before us is not theoretical, it is violence, it is fear, it is young people wondering whether the world is becoming less safe again. And the lesson from Elsie Refuge and Roberta Perkins' work is actually unmistakable. Safety has never been achieved by restricting protection. It has been achieved always by expanding it and extending it. Today's launch matters because prevention succeeds when it reflects reality. Gender equity and trans inclusion are not competing goals, they reinforce one another. Inclusive prevention strengthens safety for everyone. And this resource is not an add-on, it is core prevention work, because safer communities are built when nobody is left outside the circle of protection. Today stands within a much longer tradition. Our tradition began when women refused to accept violence as inevitable. Our tradition continued when Rebecca Perkins worked to extend safety further. At every moment, the question was the same. Not who deserves safety more, but how safety can reach further. Those decisions allowed more people to survive, more communities to flourish, and more lives to be lived freely. Today, we face that same choice, whether we narrow belonging or whether we expand care. The activists at Elsie understood something fundamental. Safety begins when women break open the door. Our responsibility now is to ensure that that door stays open and wrestle the keys from anyone who wants to rewrite our collective history to be one of exclusion. For everyone still needs protection. Thank you, and I look forward to hearing from the other speakers.
Thank you so much, Joe. It's always deeply grounding and insightful to listen to you speak. And a really pertinent reminder that this work and this shared activism has not started with this resource and with this collaboration, and that this is a very long-standing collaboration between women and trans communities, cis women and trans communities, and that the solidarity, particularly in the face of the backlash that we're seeing globally in the global context, is actually the solution and the path out, and to hold all of our rights in view. It is now my great delight and pleasure to introduce to you Star Lady, who is the director of Zoe Belle Gender Collective, and Star will present a keynote presentation for us on this work. And thank you so much, Star, for joining us and for making time today to share your words and views and experience.
Thank you, Carolyn and Joe. It's so exciting to be here today to launch our Allyship in Action frameworks for trans and gender diverse inclusion in prevention of gender-based violence initiatives. The Zoe Belle Gender Collective wants to use this opportunity to ask our allies in the prevention of violence sector to step up to address the sort of growing rates of violence that we're seeing against trans and gender diverse communities. We've written this resource with WIN to be able to empower and enable you to develop your capacity to include trans and gender diverse people in prevention of violence initiatives. Today, I'm going to be outlining what you can expect to see in our new resource. If you could go to the next slide. And so some of our key messages within this resource are around the evidence really clearly demonstrates that trans and gender diverse people experience incredibly high rates of gender-based violence. And in fact, growing backlash to gender equity is contributing to the increasing rates of violence, abuse, and discrimination towards trans and gender diverse people. We've heard from Joe about the historic solidarity between feminist movements and trans and gender diverse movements, but it's more important than ever that both of our movements work together because well-funded and highly organized anti-rights movements are increasingly restricting access to like abortion rights, reducing bodily and reproductive autonomy, and targeting gender-affirming healthcare and attacking diversity initiatives. This is affecting all of our communities, and the only way that we are going to protect our sort of rights is if we work together and if we show that sort of like solidarity. It's also pivotal that we understand that trans and gender diverse inclusion is a core part of any effective prevention of violence initiatives, and that all organizations and practitioners within the prevention of violence sector should be building their capacity to address transphobia and transmisogyny, not just because we want to demonstrate or we want to prevent violence against trans and gender diverse people, but because we're also increasingly seeing transphobia, transmisogyny, homophobia, and biphobia be used to reinforce rigid gender norms and dominant forms of masculinity that harm all of our communities. Also, our resource provides many simple and effective tips for everybody working within this sector to embed it within your work. Within your work within the prevention of violence sector, there are so many skills that are easily transferable to also addressing violence against trans and gender diverse communities. Many of the people here today will have worked beside us in and are constantly showing solidarity, and there'll be other people who are new to this work. And we encourage you to sort of work with us and work alongside our communities in that work. Next slide, please. So what drives violence against trans and gender diverse people? We know that from the Pride and Prevention series, we know that cisnormativity, transphobia, and transmisogyny are all drivers of violence against trans and gender diverse people. Cisnormativity creates the social context where trans and gender diverse people are less likely to be believed in our experiences of violence, where we are seen less worthy of support or are cynically portrayed as perpetrators of violence despite evidence demonstrating that we are much more likely to be victims of family violence and sexual assault. These forms of discrimination often enable people who use violence to act without consequence or contribute to a society where people seeking power or control over others actively seek out relationships with trans and gender diverse people because they are less likely to be challenged or held to account for those behaviors. We also know, in terms of like ending violence against trans and gender diverse people, that we need to take into account for other sort of intersecting forms of discrimination, such as racism, ableism, ageism, sexism, and colonialism, and that all our movements and struggles are needed together to work together to prevent violence. I do like to acknowledge, the history that Joe has talked about that is often erased between the solidarity between trans and gender diverse communities and feminist organizations. But at the same time, I also equally want to recognize that cisnormativity has contributed to the exclusion of trans and gender diverse people in the prevention and response to gender-based violence sectors, and that this has also caused harm to the trans and gender diverse community. And for people who've been working within feminist spaces for a long time, this can be really hard to hear and it can be really hard to hold. But it's important, as our movements come together, that we acknowledge the harm that has also occurred. The current focus of the prevention and response system has mainly been to address cis men's violence against cisgender women. And that work, it's been vital, it's pivotal, and it provides the basis for us to build upon. I want to recognize that in this work over the last few years that the Zoe Belle Gender Collective has been doing, and even from my own personal experiences, it has been cis women who have stood along beside me and supported me and built my capacity within this work, and that their allyship to me has been really pivotal, that has enabled me and other people within the trans and gender diverse community to participate. But in recognizing some of the harms that have happened includes where sometimes we see trans and gender diverse people with a really low level of understanding or being not able to recognize their experiences of family violence or feeling that they are unworthy of support. We see a low representation of trans and gender diverse people in the prevention and response workforce, in particularly trans women. I know that I'm one of the very few people, trans women, working within this space. We've also seen sometimes across Australia, so Victoria has done a lot of work in developing its capacity, but in a nationwide sort of response, we also see a workforce with limited skills and confidence to include trans and gender diverse people in their work. And it has also led to significant barriers for trans and gender diverse people in accessing supports for victim survivors. And we need to look at the system holistically to respond. We need to reach out to trans and gender diverse communities. We need to work with them, and we need to bring them into our sector so that they feel safe, so that they feel welcome. And when they are experiencing violence, they can access the supports that they need. We also want to recognize, like within our sort of society, within a Western cultural context, transphobia and transmisogyny are really rampant within our society. They've become very socially accepted forms of discrimination. In particular, this is true for transmisogyny, often which is the intersection between transphobia and misogyny that impacts trans women and trans feminine people. So much of the discrimination that we see towards trans and gender diverse people is centered in trans misogyny and is centered towards trans women. It's like trans women in sports or trans women in the bathrooms. Trans women are highly vilified within our communities, and we need to do work in addressing this. Thank you. Next slide. As I mentioned earlier, Trans and gender diverse inclusion is a key part of all effective of prevention of violence initiatives. And trans and gender diverse people are impacted by many of the same drivers of violence as cisgender women, including rigid gender stereotyping and dominant forms of masculinity, the condoning of violence, power imbalances, and gender inequality. Yet within our society, transphobia and transmisogyny is increasingly being used to undermine gender equity more broadly. And they're being used to reinforce rigid gender norms and dominant forms of masculinity. The prevention of violence sector urgently needs to upskill and prioritize addressing transphobia, transmisogyny, biphobia, and homophobia. Gender equity cannot be achieved without addressing all intersecting forms of gender-based violence. Some examples of how transphobia and transmisogyny are currently being weaponized to harm people of all genders include the false accusations of cisgender women being male or transgender through transmisogynic or sexist examination, and we're seeing this in particular within sports, but senior women with high profile, cisgender women with high profiles across the globe are currently being impacted by this. We're also increasingly seeing men bond through violence and discrimination towards LGBTI people, including gay and bisexual men. But it is not limited to gay and bisexual men. We're also seeing an increase of violence towards trans and gender diverse people, but we are much more unlikely to go to the police to report that violence, and our communities are often much more isolated. So this violence that we're seeing is used to reinforce cultures of masculinity that emphasize aggression, dominance, and control. And in particular, in relation to trans women, it's often connected to ideas that men must protect women and children from trans and gender diverse people who are seen as a threat to society. Next slide, thank you. As a leading trans and gender diverse org, we're asking you to step up and to embed trans and gender diverse inclusion in all of your work. For some people, as I said, this will be new. For some other people, it'll be work that they have already begun on. We really encourage you to continue in this work. But however, it is often really important to develop a plan as we go along with this. And so for those organisers and practitioners who are just beginning, we highly recommend that you develop a plan in undertaking this work so that it can be safe, respectful, and effective. Some of that will involve on an organisational level, considering like a brief review of your websites, your policies, programs, and other services. There can be resources through like Rainbow Health Australia and the Rainbow Tick that will help you to be able to do it. Can also be highly important to develop a trans and gender diverse communication strategy for your staff, stakeholders, and service users. Making abrupt changes without cultural changes, without providing context, including information about trans and gender diverse people's experiences of violence, or building empathy and compassion can potentially lead to backlash and resistance. And I have seen this in this work where we haven't brought people along and it has caused further harm to trans and gender diverse people, their families, friends, and colleagues. There are other sort of effective ways to do this work, including accessing professional development, can also advocate for trans and gender diverse inclusion or promote healthy and respectful relationships with trans and gender diverse people. It can be across Australia. You know, there are across Australia in different contexts. Some organisations and regions might be more ready and some might be more sort of like resistance. And it can be incredibly challenging in this workforce when your organisation is not on board, especially if that is senior leadership. And in that, there are still things that you can do, including developing your own sort of practice, can be about finding allies in your organisation or external agencies to work with and to find that solidarity. Can also be about turning up and showing allyship with trans and gender diverse communities in your region outside of the work so that they know who you are, so that you have developed the relationship. And even though your workplace isn't inclusive, they know that you are a safe and inclusive and respectful person. Next slide, thank you. In considering how to include trans and gender diverse people in prevention of violence campaigns, like in any other prevention messaging, we want to start with strength-based messaging that shares a vision of equality and celebration of trans and gender diverse people, our partners, and our families. It's important to consider how to include trans and gender diverse people in existing prevention messaging. And part of that is to include trans women in campaigns that are targeting men's violence against trans women, against women. However, also developing specific campaigns that centre the experiences of trans and gender diverse people more broadly. But in that, it's important to be aware that the trans and gender diverse community is an incredibly diverse community, and that when creating prevention of violence campaigns, it's important that we reflect upon intersectionality, in particular recognizing that First Nations, trans and gender diverse people, trans women from migrant and refugee communities, and trans sex workers often experience higher rates of gendered violence. But there can also be very different experiences between trans women, trans men, and non-binary people, and specific campaigns may be needed to address violence against different parts of our community. There's also other suggestions on the slides. Next slide, thank you. In doing this work, you're going to need to develop strong, authentic, and meaningful relationships with trans and gender diverse organizations, advocates, and communities. And that will be pivotal in the success of this work. Trans and gender diverse organizations, we want you to work alongside us. We want you to uplift us. However, our organizations are highly underfunded and under-resourced. We want you to advocate on our behalf so that we get equitable funding, so that we can work with you. Our community also has so much to add. We have a deep understanding of rigid gender norms and dominant forms of masculinity. We can contribute to this sector. We want to be empowered to do that. But also, it's important that we highly recommend that you consult and partner with trans and gender diverse organizations on large-scale campaigns, policy development, and projects, or when developing your initial capacity. However, this work should be a core part of your work, and we encourage you to build your capacity to independently ensure that your work is trans and gender diverse inclusive. I'm going to give a very simple example. Like, once you begin this work and you've built your skill, trans and gender diverse organizations don't need to see every social media post that you make. We want you to be able to do that with confidence. Next slide, thank you. A part of this work that can be more challenging is developing skills to identify and respond to transphobia and transmisogyny and cisnormativity. It can be particularly challenging when that can come from someone you admire, has expertise or value alignment in addressing other forms of discrimination, is a member of the LGBTIQ community, is a part of the same professional or social networks, or is very set and assertive in their beliefs. Or it can be really challenging when this might be our own behaviors or actions or those of our organizations. When we have also some tips from our resource on our screen to actively challenge and disrupt these forms of discrimination. Some of the ways to challenge transphobia include reminding people of the shared values and that we all deserve to live free from violence. It can also be around supporting people to change values through empathy building and compassion. However, when people are unwilling to change, setting strong boundaries about acceptable behaviour, code of conduct, or legal obligations is necessary. We're really we're really excited for you to be here today. We're really excited that you are going to be working with us. I encourage you to read the resource. We're going to be putting the resource in the chat. And yeah, that is all from me today. I hope this resource doesn't give you all of the answers, but it does give you the tools to start this work. We encourage you to engage with this work. We encourage you to gain to develop your practice and to share that back with us about what is working, what is not working, or what more is needed in this work. Thank you for coming along today to contributing to ending violence against trans and gender diverse people.
And thank you, Star Lady, for that really comprehensive overview of the background for why this critical resource exists in the first place. And it is wonderful to have so many of you here to join us in the launch. The next part of the event today really is to help provide you with some concrete reflections from our panelists, so our allies in this work. And so I would invite both Star Lady and the other panelists, Tilly and Monique, to join me now. And we'll have a conversation about what has this meant. And I think as we talked about at the start, there's a concept and there's often a values idea, but what does that look like in practice and how has it been done? And hopefully what you can take away is some hope and some ideas for how you might also then implement and amplify this work. So I am delighted to invite Star Lady is here with us. We also have Tilly Marnie, who's here as the Health Promotion Program Lead at Women's Health in the North, and who's been really working closely with Star Lady on the development of this resource and leading this work at Women's Health. We also have Ange here, who's a core consultant at Women's Health Grampians, or WHG. And we also have Monique H, who's the Racial Equity and Inclusion Manager from Switchboard Victoria. So thanks, folks, for joining us today. We will hope to have a really flowing dialogue, really time for reflections on much of the content that you've seen. And I'll open today with a question to all of the panel, really talking about relationships. So this is such a critical part of doing this solidarity work, is coming together in relationship with each other to build trust and build collaboration. So my question to the panel is how? How do we create trusting and equitable organisational and community relationships that are absolutely foundational to this work happening? And I'll open it perhaps to one of the allies on the panel to speak to your sector, to your experience and to that work in question.
I guess for me, that trust building piece is around multiple gestures, not a one-off gesture. The resource, we talk quite a lot about meaningful partnership, requiring transparency about your organisation's current capability, including the limitations that we might have. So being really clear about where we're at and where we're, I guess, hoping to get to, and recognising the steps that need to happen to get towards that that moment in time. Also, really acknowledging the resource and power imbalances between your organisation and the trans and gender diverse organisation that you're working with. I'd say, for example, ZBGC has 2 people, whereas WIN is quite a larger organisation. So
2 mighty people, might I say.
2 mighty people, yes,
Yeah.
unstoppable, fierce. But acknowledging that resource imbalance, and perhaps, it might be as simple as doing a bit of the administrative work behind a project, like taking that kind of work on board because we have more capacity. And I guess the other thing is, avoiding extractive relationships, where trans organisations give their expertise but then receive nothing in return, or very little in return, and making sure that you keep that feedback loop going. If you're asking a trans organisation for feedback on a resource or a campaign or whatever, make sure you implement the changes and then demonstrate back to that trans organisation the changes that you have made. It's all about accountability.
Thanks, Tilly. And
Yeah, I totally agree, Tilly. We have amazing.
are you able to move a little bit closer, Ange? Just a bit faint.
Yeah. Sorry, how's that? Yeah, so we have amazing, trans and gender diverse groups and organisations and LGBTIQA plus organisations in our region, but they are dramatically underfunded, under-resourced. We don't take over, but sort of ask what is needed and lend your support in any kind of practical way that you can. Amplify their campaigns, do shared advocacy and shared comms, share their resources, and lend your support in ways that you can. So if you have the ear of local government, or if you have the ear of other organisations, use your voice and your platform and your networks to really kind of share and amplify. But yeah, don't take over and ask what's needed.
Thanks, Ange. And Monique, I'm wondering, in the context at Switchboard Victoria, as Star talked about, backlash is something that we really are facing and grappling with, and that's something that's known to us in the prevention sector. It's something that we deal with as part of our work. I'm wondering, for Switchboard, in the context of ending gender-based violence and the work that you're holding there, how does an intersectional approach help you in making sense of that, and what's been happening at Switchboard on the ground in terms of putting this into practice?
Thanks, Caroline. I just wanted to start with also acknowledging the lands I'm on today. For me, that's the lands of the Wurundjeri people, and pay my respects to their elders past and present. I've learnt so much from these communities about what true allyship and solidarity means, that I think I bring to this question as well. Always was, always will be Aboriginal land. But I think that concept of intersectionality, a bit about me is I've moved across a few different sectors. So working in women's health, working in the LGBTIQ plus sector, working in family violence. In all of these sectors, there's been this, focus on intersectionality and conversations around what it means in practice. I think I could talk for a long time about what it means to me, but I thought about things that might be useful to share in this context. I think a big part of that is locating yourself in the work. And I guess that's why I start with an acknowledgement, because I think that starts with acknowledging the lands that we're on. I really appreciate with this resource how it acknowledges the ongoing impacts of colonisation for Aboriginal and Torres Strait Islander communities, but also acknowledging that gender itself is so deeply shaped by social and political contexts, and you can't separate that from colonial histories that are ongoing and continue to contribute to transphobia and homophobia. So I guess when people talk about bringing in like the historical, larger political, social context, I guess it's finding ways to bring in these conversations about colonisation and what it means to be a settler on stolen land. I also want to acknowledge, I think, like that this history of intersectionality comes from a real activist history, but it has been often co-opted and watered down or disconnected from its radical history. And it becomes made about like particular groups or intersectional identities. And it's often discussed as a tool to analyse, but it doesn't take you to that next step of action and actually working towards change. And I love that, today we're talking about that, actually, our responsibilities as allies to engage in challenging conversations about power and take responsibility for the harm that's being caused. I hope I can talk a bit more later about those conversations and what they feel like in the context of my work. But I love the invitation to sit gently with the discomfort and examine what it can teach us and recognise that it's everyone's responsibility to end that violence. I think that's a lot of, I guess, what we talk about when we talk about intersectionality in the work I do.
Wonderful. Thanks, Monique. And I know Switchboard more generally has really been doing a lot of reflective work in this space. And, that whole of organisation approach has been so foundational to building on that and turning ideas and concepts into action and actionable activity that occurs. I'm just going to actually jump.
Can I just
Yeah,
add
go
into there,
start.
Caroline?
Yeah,
Sorry, I
sure.
just feel it was really
No, all
important.
good.
Today I'm also just want to acknowledge I'm coming from Jaja Wurrung country, the shadow of Lian Ganuk, one of our sacred mountains here. But important, I think it's really important to reflect upon, intersectionality in this work. And I think it's never been more sort of like obvious the connection between transphobia, transmisogyny, racism, sexism, and colonialism. I mean, here in Victoria, I know late last year we had some very harmful anti-migrant rallies where we had sort of like neo-Nazis, at those sort of rallies. And then immediately after that, we saw some of the neo-Nazis go to Camp Sovereignty here in Victoria and attack First Nations people. But often in it, we saw older men telling the younger men to assault the women in the camp. And there, I think we can begin to really clearly see how it is all sort of like interconnected. Unless we sort of like do that work around intersectionality and around sort of oppression against lots of different communities, it's not going to work. And we also know that those neo-Nazis and right-wing organizations are incredibly sort of like transphobic and homophobic. And part of it, and what we need to be seeing is we need to be seeing like greater solidarity and connections. Like for trans and gender diverse organizations, we need to be developing those really strong relationships with First Nations communities. We also need to be reaching out into the sort of like multicultural and multi-faith organizations, and also to acknowledge within our own communities that we have to deal with the racism, that is occurring. Often, I think LGBTI organizations, cannot necessarily have the strongest relationships with other parts of the community. And I think we need to sort of like deal with that through real relationship building and real connections beyond this idea of just sort of like colonial, I'm only going to develop relationships within my work, and work. We need to be thinking about those relationships outside of our work so that they're authentic and so that there is trust already there before we start the work or before we start asking things of particular communities.
Thanks, Star Lady. So there's two great questions that I'm going to turn to now, actually from the floor. So I encourage folks who are listening in, if you have particular questions, to raise those in the chat, and we will get to as many of them as we can. The first one is back to you, Ange, and this is from an audience member who is in a rural and remote context in Queensland, where unreported violent hate crimes are still commonplace. They're in regional Queensland. They have a bobcatter as their local member in that region. So quite a rural and remote part of the region. And Star Lady had also mentioned always being curious about other people's thoughts and how to proceed without bringing more harm to TGD communities. So perhaps, Ange, a reflection from your context, given that you're also working in a rural and regional context, and whether there's thoughts or ideas that you have from your experience that might be helpful for others who are also working nationally, and particularly for that person with the question from regional Queensland.
Yeah, thanks, Carolyn, and thanks for the question. So yes, we work in one of the most rural and regional areas of our state in Victoria. And, I think that, yes, it's true that there are often more conservative views about gender in rural and regional communities. Having said that, there are trans and gender diverse people in every corner of our region, and there are allies in every corner of our region as well. So it's about finding who they are and working with our allies. We do this work in a regional area, and it absolutely can be really challenging to do this work. I guess one of the benefits that we have as a women's health service working in a rural and regional area is that we live in this area, we work here, we're part of the community, we're part of sporting clubs. You'll see us at the supermarket, you'll see us at the pub. And so we have opportunities all the time, like in big and little ways, to influence and to create change. We work with over 150 organisations through our Communities of Respect and Equality Alliance in every corner of our region. And, we are a trusted partner of theirs. So we are really able to influence the work that we do. You know, we can role model, we can do all kinds of things, and we can build trans and gender diverse inclusion into all facets of our work, not in a siloed way, but we actually weave it through everything that we do. Yeah, I think it's all about finding who your allies are in these places, because there are allies everywhere. So it's connecting up and finding ways to show that you are an ally, and coming together in solidarity.
Thanks, Ange. And there's always good old LinkedIn where people can find each other. Although, you know, I'm not a major LinkedIn fan, but it is a useful way for connecting and finding allies across the professional sector. So I do encourage people to reach out after this in that context. So I guess the next question is really in relation to what practical strategies organisations can adopt to embed this practice, particularly holding in mind that really important value of not wanting to further harm, and be really clear about where we are currently and what happens to not actually either consciously or unconsciously perpetrate any more harm in this space. Tilly or Monique or Ange, what are your reflections in what you've learned and what you've put into practice as an ally organisation?
Jump in. I think for me, you know, the resource provides a number of recommendations around prevention campaigns and programs work. But what I particularly like to speak to is about the work that needs to be done in terms of organisational culture change, and looking kind of internally as well. So at Women's Health in the North, this has included changing our constitution, changing our equal opportunity exemption. We have an internal trans and gender diverse inclusion working group. We're updating our, you know, onboarding and induction processes. And also we have an ongoing investment in periodic training for all staff. When we're not done, this is part of a journey. And I think, you know, without coupling that external work like programs or campaigns with internal reflection and improvement, that's where it can feel really disingenuous. And yeah, that organisational and policy change is really important if we're going to be accountable to trans and gender diverse organisations and the communities that we're serving as well.
Thanks, Tilly.
Are you jumping in, Monique?
Yeah, I can go next.
Monique, go.
Yeah, I was thinking about what you were saying about organisational change, Tilly, and I think linking back to that conversation around intersectionality and going beyond just using it to talk about particular groups or individuals, there is like a more interesting and useful conversation to have around dominant cultural norms and, you know, parts of our identity that we might not be as aware of because we fit into those cultural dominant norms, whether that's the fact that we're cis, the fact that we're middle class, the fact that we're, you know, all of these dominant identities that, you know, are hard to see unless you're outside of them. And then they're quite visible to you for anyone who's had that experience of not being part of a dominant culture. And I think when I think about, you know, practical things that organisations can do, especially when thinking about partnership and solidarity work, is be more aware of those dominant cultures. And to do that, I think you have to be able to be having conversations in your organisation to actually name those things. Something that I think about a lot is cultures of white supremacy that I think work against solidarity and allyship. But some examples of what that could look like is the sense of urgency that many of us feel in our work, which is, you know, brought on by funding timelines, lack of funding for prevention work. You'll often hear lack of time as an excuse for not doing intersectional practice or engaging with people in respectful ways. Also things like prioritising the written word, that we spend all our time answering emails, writing reports, and that either or thinking, that idea of, you know, we're going to talk about violence against this particular community or this community without being able to understand the connections in the system. So I guess like being able to talk about those cultures allows the space to be able to actually strategize how we might challenge them and work in different ways that are actually more collaborative, share power, and are more transparent and honest. And I think the only other thing I would say to that is just, while you're having those conversations, to actually define for yourself and for your organization what your values and principles are in this work, so that when you are experiencing backlash or resistance or transphobia or transmisogyny, you can come back to those values and principles. It's not just, you know, one individual having a fight with another individual, but actually being able to say, in our organisation, these are the ways we work, these are the values that we're trying to uphold, and so this is why we are taking these actions.
Thanks, Monique. And that's a really beautiful segue, actually. You preempted my next question, which was one from the floor, really looking at resistance and backlash. And we know that this happens. And as equity spaces begin to reveal themselves, how much then the backlash often and the resistance takes place. And that can be within people, within organisations, and of course within our wider community and global context. So I'm going to weave together two parts of the question. So one was really around some practical examples really of how you have dealt with backlash or resistance within your own organisations or contexts. And then also there's a cisgendered straight man who's in this group. I'm aware that that is not a representation on this panel. Our work is highly gendered. So the question is around to the amazing expert panel, what tips and advice you have for increasing and strengthening allyship in other men in community. How do we bring them into this conversation? So the resistance and backlash piece, but then also how do we actually invite men to be the accountability allies in this work as well?
I'm happy to jump in and talk about resistance and backlash.
Thanks, Ange.
So working in the women's health sector, we are really familiar with resistance and backlash. It's not new to us. You know, we talk about things which, you know, we get resistance to all the time, whether it's talking about gender-based violence or talking about abortion access, or and the skills that we have in dealing with resistance and backlash are super transferable when we're talking about transmisogyny. We can transfer these skills really easily, actually, and we're well equipped to do so, I think. We have had, you know, quite a lot of resistance in the form of like overt backlash, I guess, you know, on social media and things, right down to passive resistance. But, the way that we deal with resistance and backlash, we don't need to invent a new way, I don't think. I think we already have the tools to deal with resistance and backlash. If we get something on our social media, which we often do, we've got a really clear process for dealing with it. So we go back to our values and we reiterate, you know, our stance on trans and gender diverse inclusion in our organisation. I don't think that we need to. I think that we need to be brave in our work, in all of our work, and this is no different, I think.
Thanks, Ange. Star Lady, did you have something that you wanted to say in relation to how we bring men on this journey? I know you've spent a lot of time deeply embedded in exactly this piece of work.
Yeah, I mean, I think there's a lot of myths, firstly, around like men's sort of like gender and sexuality. I know, that many men are attracted to trans and gender diverse people, including trans women, but it's often erased within our society. Obviously, we have our trans femme resources that have directly worked with men, but it's often not recognised within the sort of broader prevention of violence sector that we're an expert in terms of working with sort of like men and boys. I would just encourage anybody who is to reach out to us. I mean, what I've broadly seen over the last, few years is that many of the women's services have really stepped up to work with trans and gender diverse communities and to work a lot alongside us, form strategic relationships. I have not seen that with the men and boys sector. And if you are a man working within this space, reach out to, us, or if you're an organization, come to us. We really need to develop those relationships. But I think there needs to be a lot of reflection within the organizations that are working with men and boys around sort of like deep-seated like homophobia, transphobia and biphobia, where there's a discomfort to sort of, I feel like, go there and to form those for relationships. But yeah, I mean, probably it's in terms of like things that have worked really positively. Like recently, we're working with Jesuit Social Services, and their sort of men's programs, and it was the first sort of men's organization that's really reached out to work and support us. But we'd like to see more of that.
Thanks, Star Lady. And really, that brings me to moving to stories of hope or moments of success. We have about 10 minutes left on the panel. So I just invite our allies on the panel. What's been a moment for you that really you've been incrementally sitting with this? There's lots of complexity in the space. What's something that's really sat with you as a moment of, aha, we're actually making movement here, or something that felt really meaningful in terms of that impact for change?
I mean, maybe this is an obvious one for me, but a real moment of hope for me has been the incredible response to this webinar. Like over 350 registrations is far beyond what we had anticipated for this work. And seeing that kind of nationwide interest as well just shows how many people in our sector want to learn, are ready to learn, to step up as allies, and are keen to strengthen their practice. And in this time of backlash, seeing so many practitioners lean into inclusion is just a really powerful reminder that we're not alone. This work is wanted, and it is possible if we're all working together for that collective action piece.
Thanks, Tilly. Ange, did you have a reflection?
I could share a story, a success story, I suppose. My amazing colleague Carly, who's our gender and disability advisor, was doing some community connector work for the new Respect Ballarat saturation model around, it was around women with disabilities. But she was really intentional in framing and using plain language about that this is actually for, women and gender diverse people and trans and transfemme people and trans masculine people as well, and actually did a community consultation, was really intentional about building inclusion in, and out of 12 participants, I think at her consultation, 6 of those were trans or gender diverse, and so there were people who had never engaged with our sector before, people who were maybe not connected to the LGBTIQA plus community here in Ballarat, but who had through really intentional inclusion had become part of this consultation, and going forward will be continue to be part of the work that we're doing around prevention of gender-based violence against people with disabilities. So just a really beautiful example of how being really intentional with language and making space for inclusion really does work.
And it really is these micro moments and localized contexts that see global impacts for change, and the movements and the solidarity that sees what we want to see. And Monique, how about in your context? What story of hope or success or meaningful piece of work is sitting with you?
I think there's something in like the small moments where, I worked across a few different sectors, but I'm always thinking about, being able to work with migrant and refugee communities. And it's really meaningful to me when there's space to have the conversation about trans and gender inclusion. And sometimes it's moments where people will reach out to have conversations and be really honest about not knowing what the solution is, or not necessarily having like a clear ask, but actually just wanting to start the conversation. And those moments feel really powerful.
Thank you. And so in our last few minutes, I will just ask all of you on the panel, what is, to either share a short message, what's your one takeaway that you'd love the audience to hang on to as to continue this work of allyship and solidarity in their own communities and organisations? What's your key tip or takeaway that you'd like to leave people with? And perhaps Star Lady, we'll start with you.
No, I'm doing the closing remarks, so I'm going to hand it over to
I'll come to you
people.
later.
Yes.
Okay, excellent. Beautiful delegation to allyship in action right there. So Tilly, Angel, Monique, you're up.
I'll go. Okay.
Thanks, Ange.
So it's something actually that Star Lady said to me when she came and did training with my organisation, and it was like, don't be afraid, just do it. You know, don't wait for everything to be perfect, and you know, just get out there and have a go. So I would say, don't be afraid, have a go, and find your allies, because there are allies everywhere.
Thanks, Ange. Yeah, it really is feeling the discomfort and doing it anyway, and knowing that that is in fact part of the process for change. Thanks. Tilly or Monique?
I can go next. I think it's maybe a similar kind of message that this is slow work. Like there is such an urgency, but also to have patience and purpose to keep fighting for something that we might not see in our lifetimes. There's some things I definitely want to, but thinking about the big picture of like justice for everyone and end to violence everywhere, that's huge. And we don't have to have all the answers of how we're going to get there. But I think having those values and principles to your work can like keep you on track and towards that bigger picture. And I think the other thing I would say is, yeah, like we will cause harm and we will get it wrong. And part of it is being open to that. Like there will be a lot of it sitting in that discomfort. I'm so like, you know, a lot of gratitude for being able to join this panel and share my reflections. And also at the same time, I'm thinking about the question that's come through around First Nations voices on panels and thinking about ways that we could do this better. So I think it's being able to always engage in those conversations and lean into the uncomfortableness of that.
Thanks, Monique and Tilly.
I guess for me, like the main takeaway that I'd like people to take from this is that inclusion doesn't just happen, it happens through intentional choices and those kind of everyday actions. So I guess like to everyone watching today, I guess what are you doing next? Are you sharing this resource with your team? Are you going to talk about it at a team meeting? How are you going to set any next steps? And if you want to talk to us about this more, we know that this Q&A session has probably kind of run out of time, but reach out to us. Peer learning is absolutely part of this work, and working together is the only way that we're going to reach where we want to reach, which is a future free from violence for everyone. For those coming to the quick plug, for those coming to the Prevent X conference in Melbourne, we will be there, and absolutely please come up and have a chat to us more about this work.
Thanks, Tilly. And an explicit invitation from the panel that this is not the end of the conversation. And I know there were quite a number of questions that we didn't have, sadly, time to get to today. But I did want to make sure that I left time at the end for Star Lady to provide some further reflections and a call to action and invitation to all of us who are here in the panel today. So thank you, Star Lady, for that.
Thank you. I just want to, in sort of like beginning to sort of close off today's session, I just want to remind everyone that it's everybody's responsibility to address transphobia and transmisogyny, and that in this movement, in terms of ending violence, it's really important that we show solidarity and develop relationships between all of our organizations and all of our movements, and that is pivotal. It's not always easy work. I reflect upon Monique's talking around, taking some of that work slow or developing that relationships with people that is really essential within this work. But also, I'm just really appreciate that you have all shown up today, that you're all contributing and committed to this work, and that we just need to like keep going, in it. And sometimes it will be challenging. It is sometimes incredibly hard to challenge transphobia and transmisogyny, but there is greater risk in staying silent. We need to be having brave conversations and to be remembering that actually challenging transmisogyny and transphobia and homophobia and biphobia is key. It's pivotal to this work, and unless we do that, then we're not going to end, gender-based violence. So thank you. Let's keep learning, let's keep working together and improving our work. Thank you.
Thanks, Star Lady, and a powerful call to action for all of us. So, as we wrap up the webinar today, I just want to firstly give a huge thank you to the speakers and partners and Auslan interpreters who've really helped facilitate the panel and the launch today. We are really hopeful collectively that this event builds the next stage and the next iteration of our movement and a future that we all want to see where all genders are safe, affirmed, and celebrated. So there are links in the chat to the Allyship in Action resource, and those will also be on all of our websites. And there is an evaluation link here. Your feedback is incredibly important to us, so please do pop that into there. We will continue to use that to build this resource and build the capability in our sector. And there will be a recording that's available once we finalise the webinar. I do encourage you once again to seek out support if you need it, and if this has raised any issues that are impacting you, whether that's today or in the days to come. And we'll follow up with you in a few months' time to see how you're going, how helpful the resource has been for you, and how you're using it to implement change within your own organisations and contexts. We kept pretty much everyone until the end of this webinar, which is extraordinary. So that demonstrates to me the commitment that we see. And I want to thank you all for your time, for your allyship, and for being part of this very important conversation. So thank you, everyone, and we will now close the webinar.